I don't know what we're doing. I think this bill is beyond repair, and I think everybody in the country is pretty much pointing that out. So now we're going to try to change it a little bit. I understand this is the first of two meetings this week for your third step in the health care repeal strategy. First, the majority passed their disastrous health care repeal bill, I think, last month after drafting it somewhere. Second, the Health and Human Service Secretary has already begun, illegally, I believe, using administrative measures to undermine the Affordable Care Act, which is absolutely the law of the land. And we have the scars to prove it, don't we, Rich? So that brings us to today and the majority's so-called third bucket of legislative fixes. And I want to be as clear as I can, Mr. Chairman, no amount of patches will fix this bucket. You don't have to take my word for it. Senator Cruz said, and I quote, "I have called the bucket 3 the suckers bucket," end quote. Senator Cotton has called this process, quote, "politicians engaging in spin," end quote. Now, the nonpartisan Congressional Budget Office found that the repeal bill would kick 23 million Americans off their insurance, including 14 million people in the first year alone. I think it's going to come as a surprise to them as well, because I don't think that's so well known. It also would gut the protections for people with pre-existing conditions and making health care for many. But there's another portion of this that we don't talk about at all, and certainly I'm surprised. We understand that you want to pass the health care bill first because you want $880 billion out of Medicaid coming out of the health care bill, and that money is to pay for the corporate tax cuts and the tax cuts for the top percent. In the first place, I can't see how you would ever justify taking the money away from health care for the poor people so that you could give it in corporate tax money. It's pretty bad, and we all understand, I think we do, that the majority of Medicaid money is used for people in nursing homes. Isn't that correct? If that's so, shouldn't you be telling them now before the 4th of July that they're going to have to take mom or dad home or make some kind of other arrangements for them when they can't pay for the nursing home? So, and then on top of that money, the $880 billion, the Trump budget calls for another $610 billion in cuts to Medicaid. And I have noted that a number of senators on both sides of the aisle said that won't work. Despite impacting 1/6 of our economy, the bill was rushed through the House without a single hearing, any input from experts, or a score from the nonpartisan Congressional Budget Office. And I was particularly distressed to read today that your colleagues on the other side of the Capitol are taking this process to a whole new level by sending their repeal bill with CBO without even releasing it first, in addition to skipping the committee process. If reports of a vote before the 4th of July recess are correct, that means the public may not even see this bill until the week the Senate votes on it. And if it should pass both houses, we said before, people had better be looking at how they're going to be paying nursing home bills. One Senate Republican aide defended this by saying, quote, "We're not stupid," end quote. You've all seen the protests, you've heard the phone calls, you've read the letters against it. You know how unpopular this repeal is, but you're moving ahead just to fulfill a political talking point. I would be happy if, even though you told us 60 times that you already had a bill to replace ready, and that turned out to be far from the truth, I would forgive you all that and let us work together to try to bring what we all think needs to be done to make the ACA acceptable. This would make much more sense, and frankly would bring back the old days of what we used to do in the House of Representatives. So we have a bad process and a bad product, and I don't think anything we're going to do here today will change that. So thank you, Mr. Chair. I appreciate it very much, and I yield back.